Did you know that Hawaii had a form of free healthcare for Native Hawaiians and affordable healthcare for non Hawaiians? Well, you can probably guess why we don't have that anymore, but let's talk about it. Before 1893, healthcare here wasn't treated like a commodity. Pre colonial contact, La'au Lapa'au, Lomi Lomi, and Kahuna Lapa'au anchored community care. In 1839, King Kamehameha III declared protections for the people, land, and property, saying public revenue was for public good, including health. By 1850, Hawaii had a board of health, earlier than most of the United States, running quarantine, vaccination, and epidemic response. By 1859, King Kamehameha IV and Queen Emma opened Hale Ma'i o Kawahine Ali'i, today known as Queen's Hospital, after fundraising door to door and getting more funds approved by the Hawaiian legislature. For decades, Native Hawaiians were treated free of charge while non-natives paid day rates, because kingdom law guaranteed that land revenues were meant to support the people. Dedicated taxes on passengers and seamen also supported care. After white sugar barons illegally overthrew the Hawaiian Kingdom in 1893 with the help of the U.S. Navy, and then forcibly annexed Hawaii into the United States in 1898, that system was dismantled. Territorial officials questioned the public funding for Queens, calling it private, and then eventually cut off free care for Native Hawaiians by the early 1900s. Instead of honoring Hawaiian law as international rules required, the United States turned care into pay-to-use. Queen's Hospital is still the state's largest private nonprofit and Hawaii's only level 1 trauma center, with about 575 beds, over 3,600 employees, and major teaching partnerships. The founding mission to improve Native Hawaiian health still matters, but today Native Hawaiians face deep health disparities. Diabetes rates more than double those of white Americans, higher rates of heart disease and cancer, and disproportionate burdens of obesity. Our kupuna and Ali'i built a system that looks a lot like universal health care for Kanaka Maoli, and then the United States dismantled it. And now here we are again with another looming government shutdown, with politicians in DC fighting over whether or not people should have affordable health care. For Indigenous communities, we have always known that health care is a fundamental human right, whereas capitalism treats it like a business, even if it means whole communities suffer and die. Native Hawaiians still live with the consequences of the theft of our nation, of the systems that worked for us, just as other Indigenous nations live with broken promises and structural neglect. So when we talk about universal health care, we're not dreaming. We're remembering what was stolen from us. Until we restore Indigenous stewardship and values and dismantle capitalism, our lives will always be weighed against profit margins.